5.3 million Americans live with a TBI-related disability. That's 1 in every 60 people. Here today to raise awareness about the impact of brain injury and make sure people have access to the support they need is Megan Rood, a physical therapist at Hartford Healthcare. Megan, welcome.
Hi, thank you for having me.
Great, thanks for being here. So what is a brain injury and what are the common causes?
A traumatic brain injury is any injury to the brain that alters its function or changes its pathology. And it can be caused by multiple things. It can be internal causes, including a lack of oxygen to the brain or exposure to any type of toxins, or it can be from increased pressure in the brain from something like a tumor. It can also be caused by external forces such as a fall, someone striking their head against someone or something, which it often happens. We see that a lot with our athletes. It can also be caused by a motor vehicle accident or if someone happens to be assaulted. And often you'll hear a mild traumatic brain injury referred to as a concussion.
All right, let's talk about that. What are some of the symptoms someone experiences after a concussion?
Well, there's a whole constellation of symptoms that people can report, and some of them include a headache, dizziness, feelings of fogginess, and difficulty carrying on or following a conversation. They may also have nausea, which could then lead to some vomiting and not feeling well, slurred speech, ringing in the ears. People may also have increased sensitivity to lights, including overhead lights, such as fluorescent lights. And they can also have an increased sensitivity to loud noises and to sounds, which can then further exacerbate some of those other symptoms, including those headaches and feelings of dizziness.
All right. When should someone seek rehab after having a brain injury?
Ideally, they would get care as soon as possible because earlier care is associated with better outcomes. But we also recommend that anyone who has any new or lingering symptoms seek care.
All right. Tell us about what types of rehab services can be helpful after a concussion and how they help.
So after a concussion, physical therapy, occupational therapy, and speech therapy can all be beneficial. A physical therapist can address any issues related to neck pain and headaches. We can also work on your balance to make sure that you're going to be safe in accessing your home and your environment. We can also work on improving the coordination between your eyes and head movements, which can, if there is an interruption in that, it can lead to increased difficulty with using screens, using a computer, which can interfere with your ability to work, or it can interfere with a student's ability to read, so their ability to complete their schoolwork. We can also help with them returning back to sports. Occupational therapists can address any visual deficits and address any issues with fatigue. And then speech therapists can also help with their issues with any cognitive fog or difficulty with any other type of mental status impairments.
All right, great information. Megan Rood, physical therapist with the Hartford Healthcare Rehabilitation Network. Thank you for all that great information.
Thank you.
Thank you.